Thank you for attending this presentation. We at BP Healthcare Group hope we can answer the questions you have regarding your health screening report which you are currently holding in your hands. Your report shows the tests that were done, followed by the measurement from your blood or urine, and lists the normal range in brackets at the end. Needless to say, we all would want our scores to be in a normal range. First off, let's take a look at your lipid profile. Lipids are the fats and oils in our bodies. HDL cholesterol is good cholesterol. It prevents blockage of our blood vessels. On the other hand, triglycerides and LDL cholesterol are the bad lipids that clog our blood vessels by forming plaques that will lead to atherosclerosis. The total cholesterol is the sum of all the bad cholesterol in your body. Total cholesterol or HDL cholesterol tells us the risk of developing atherosclerosis, which in turn will lead to heart disease and stroke. Those who have a ratio of more than 4.5 are at risk. This is what happens when you develop atherosclerosis. Diet control is important in controlling this problem, as is exercise and getting enough supply of good cholesterol from your diet, like taking omega-3 fish oils. Next up is your blood glucose. This test tells you whether or not you have diabetes. A fasting glucose of more than 7 millimoles per liter is considered a diabetic level. A fasting glucose level of more than 5.6 millimoles per liter means you have impaired fasting glucose, a condition which can lead to diabetes if you do not modify your lifestyle. Diabetes is the leading cause of many debilitating diseases like stroke, eye damage, heart attacks, kidney damage, impotence, difficulty passing urine and numbness, and decreased blood supply to our arms and legs. Hematology is the study of our blood. Red blood cells bring oxygen to the tissues of our entire body. Total RBC, hemoglobin, and hematocrit tells us the quantity of red blood cells in our bodies. MCV assesses the size of our red cells, whereas MCH and MCHC tell us about the color. RDW tells us about the speed at which our bodies are producing new red cells. White blood cells are our defense cells. Total WBC tells you the total amount of white blood cells in your body. White blood cells are further subdivided into polymorphs, lymphocytes, monocytes, eosinophils, and basophils. The quantity of these cells are expressed in percentage, differential count, and actual number, absolute count. White blood cells do not remain stagnant in number. They increase or decrease according to your body's needs. An infection may make your white blood cells go high, but they may be slightly low when your body does not need them. Finally, platelets are the blood cells that help your blood clot when you have a bleeding wound. At the end of your full blood picture, there is an overall comment on your RBC, WBC, and platelets. An impression will be given, telling you the conclusion of the test. There will also be a suggestion to tell you what to do next if you have something abnormal in your full blood picture. The blood grouping test tells you the group of your blood, which is usually expressed as A, B, AB, or O, followed by rhesus grouping, either positive or negative. The renal function test is a test that assesses the efficiency of your kidneys. Sodium, potassium, and chloride are electrolytes or salts circulating in our blood. Urea, creatinine, and uric acid are toxins which should be eliminated by your kidneys. If they are high, particularly urea and creatinine, it may mean that your kidneys are not functioning to their full capacity. However, if only your uric acid is high, it usually means an excessive consumption of protein-rich food, which includes meats, seafood, eggs, and beans. How does a high uric acid affect us? Hyperuricemia, which means high content of uric acid in our blood, can cause two problems. Gout, a condition where uric acid gets deposited in our joints and forms crystals, which in turn leads to pain and joint inflammation, and ultimately joint deformities. The other problem associated with high uric acid is the formation of uric acid stones in our urinary tract. These are a few photos showing the joint inflammation and deformities caused by gout and some uric acid stones found in the kidneys. The liver is an important organ that produces proteins that are essential for our body function and to deactivate toxins that we put into our bodies on a daily basis, like alcohol, cigarette smoke, unhealthy food, drugs, and so on. The liver function test measures the ability of your liver to carry out its function. Total protein tells you the total amount of protein in your blood. Albumin is a type of protein that carries hormones in our blood. It is also used to assess a person's nutritional status. A high albumin may mean an excessive intake of protein. Globulins are proteins that are used to make antibodies. A high bilirubin can cause someone to become jaundice, that is, a yellow discoloration of our skin and other tissues. It is usually high due to problems in the liver or gallbladder. However, if only the bilirubin is high, without any other accompanying abnormalities, it may mean that you just normally produce more bilirubin than an average person. SGOT, SGPT, alkaline phosphatase, and GGT are collectively known as liver enzymes. If they are high, it means that some liver cellular damage has occurred. Low liver enzymes are not a cause for worry. Next is your hepatitis B screening. Hepatitis B is a disease caused by a virus that may damage your liver, cause you to become a carrier, and also cause liver cancer. A reactive hepatitis B surface antigen means you have been infected by the virus. Non-reactive means you are not. Anti-HBs measures the amount of antibodies against hepatitis B in your body. A non-reactive anti-HBs means you do not have any antibodies in your body and you should go get yourself vaccinated. If there is a number stated for anti-HBs, it means you do not have antibodies against hepatitis B. A number more than 100 means you are immune to the disease, but a number less than 100 means you need a booster dose. Hepatitis is transmitted from mother to child, from blood transfusions, tattooing, and sharing of infected needles, sexual contact, and transmission through other body fluids. This section covers other tests. Free T4 is your thyroid hormone, which controls your metabolic rate. Calcium and phosphorus are essential electrolytes for the health of your bones and muscles. VDRL test for syphilis, a type of sexually transmitted disease. Reactive means there is a possibility that you are infected. Non-reactive means you are not. Rheumatoid factor checks whether you have rheumatoid arthritis. Next is your urine test. pH tells you the acidity of your urine. Protein, glucose, ketones, and blood should be negative in a normal urine test. Color is self-explanatory, usually yellow or straw, light yellow colored. Transparency should be clear. From microscopy, pus cells, defense cells of the urinary tract, and epithelial cells, skin cells, are present in most urine samples. However, you do not want any red blood cells, casts, or bacteria present. Specific gravity tells you how concentrated your urine is. Cancer markers help us check for any possibility of cancerous growth in your body. CA12-5 checks for ovarian cancer. Prostatic specific antigen checks for prostatic cancer or enlargement. AFP checks for liver and testicular cancer. CEA checks for gastrointestinal and lung cancer. CA15-3 checks for breast cancer. CA19-9 checks for pancreatic and colonic cancer. Anti-EBV VCA checks for nasopharyngeal cancer. This is a visual summary of all the organs that are checked by the various tumor markers. Other optional tests. Hepatitis A virus IgG. Reactive means you have antibodies against this disease. Non-reactive means you do not. Helicobacter pylori is a type of bacteria that infects our stomach and can cause gastrointestinal discomfort, gastric ulcers, and gastric cancer. We want it to be negative. Seek treatment if you are positive. Homocysteine assesses the risk of developing heart disease. Too high a level means you are at risk. High-sensitive CRP tells you if there's any inflammation in your body. Microalbumin is a very small protein molecule. Presence of big amounts of microalbumin in your urine is an early sign of kidney disease. Anti-HIV 1 and 2 screening test for possibility of HIV infection. Reactive means you have been infected. Non-reactive means you're not. Hepatitis C virus anti-HCV test tells you whether or not you have been infected by the hepatitis C virus. Reactive means you are infected. Non-reactive means you're not. To date, there is no vaccination for hepatitis C available. If you have encountered any abnormal results in your health screening, it is advisable to go see our doctors at your nearest BP diagnostic center for advice and treatment. The best approach to handling a disease is to form a personalized care plan for each individual, as we have to recognize the fact that each of us are different. Start with a health check, follow up with a complete health risk assessment, and meet your health coach for guidance. This presentation was brought to you by BP Healthcare, your first choice healthcare solution provider. Thank you for listening.